I told you that most NCLEX questions give you the answer before you even read the options? Now, it's hidden in the cues and the trends. So today, I'm going to teach you how to spot those patterns. And those are those subtle changes in labs and vital signs that tell you that a patient is about to decline. So, this is lesson 3 in my clinical judgment and prioritization series. And this skill is an absolute game changer. So, let's begin. Now, with every NCLEX question, it begins with one goal: find the most important cue. But students often do the opposite. They read the details, the symptoms, the background, the diagnoses, but they miss the one thing that matters. What's getting worse? What's new? What is abnormal for this particular patient? So this section is all about training your brain to read questions like a clinical detective. Someone who doesn't get distracted by the noise, but instead asks, what is the one thing that indicates danger? What pattern is emerging? What changed from last time? And once you learn to find the uh-ohs, your accuracy skyrockets. So what is a cue? Well, a cue is any piece of information that signals something important about the patient. So on NCLEX, cues can come from vital signs. So your blood pressure is dropping, your heart rate's rising, the respiratory rate is rising, the SpO2, the oxygenation status, is falling. It's seen in labs. The potassium's rising, the sodium is dropping, your white blood cell count is rising. Hemoglobin and hematocrit are low. The lactate level is high. It's seen in your assessment findings. Patients' new confusion. They have chest pain. There's an increased work of breathing. You notice cyanosis. You notice no urine output, and new drainage or bleeding. You may see it, you may hear patients say, I feel like something is worse. I can't catch my breath. I'm dizzy. And then you're looking at the trends. Yesterday things were normal. Today things are abnormal. Now it's gotten worse. Okay. So understand the most important thing: one single abnormal number means less than a trend of numbers moving in a dangerous direction. So, what is a trend? The trend is a pattern over time, it's not a single reading. This is where many students get lost. So, let's define the most common trends: falling blood pressure. So, let's say 128 over 84, now it's 110 over 72, now it's 92 over 60. So that is going to show you a shock pattern. Even if the 92 over 60 is borderline, the pattern is the red flag. Okay, rising heart rate. So you had 88 heart rate, now it's 104, now it's 122. That's going to show you compensation, and that's going to go into decompensation. The heart is trying to make up for something going on in the patient's body. Rising respiratory rate. 18, 26, 32. That's showing you respiratory distress. The lungs are failing to meet the oxygen demand. A falling SpO2, a falling oxygenation status, 96 to 92 to 88. That's showing hypoxia. That's showing hypoxia progression. Decreased urine output, 60 milliliters an hour. Now it's 40 milliliters an hour. Now it's 15 milliliters an hour. So now we're having a kidney perfusion failure. Patients showing increasing work of breathing. They're using new, their accessory muscles, nasal flaring. They're unable to speak in full sentences. Okay. Increased confusion. The person was alert, now they're disoriented, now they're lethargic. Okay, that is showing a neurological decline, or it could be from hypoxia or even sepsis. Okay. So when you're looking at the up-O patterns, okay, here are the most, testable NCLEX deterioration cues. Okay. Number one, new confusion. It could be because of hypoxia, sepsis, until you prove otherwise. Okay. So if a patient suddenly becomes confused, this is an NCLEX red alarm. Number two, respiratory rate greater than 30. That's showing respiratory distress. This is often the earliest sign of decline. This is so number three, SpO2. So your oxygenation status is less than 92 on oxygen. Okay. That is going to tell you that your patient is having a failure to oxygenate. Your systolic blood pressure is greater than 90, or your MAP is less than 65. So that's telling you this patient is probably going into shock. So combine that with a rising heart rate, and it becomes life threatening. Number five, potassium greater than 5.5. That's showing a risk for fatal dysrhythmias, okay? Especially with EKG changes or peaked T waves. Number six, no urine output. That'll show you the organ perfusion is failing. The kidneys are very sensitive to early hypoperfusion. Number seven, increased pain after surgery. That is letting you know that there is a complication out of, you know, so your the patient's pain is out of proportion. And that could mean compartment syndrome, it could mean internal bleeding, it can mean a pulmonary embolism. They can um they can even tell you maybe there's a leak, like in the peritoneal space. Okay. And number eight, rapid neural changes. That is an emergency. If a patient has sudden slurred speech, facial droop, one-sided weakness, that's letting you know stroke. These eight things are always high priority. Okay. Now let's go into labs. You don't need to memorize every lab for the NCLEX, just the ones that can kill your patient quickly. Okay. So here are the big six. Potassium. Normal 3.5 to 5.5. Dangerous if it's greater than 5.5 or less than 3.0. You want to watch the trend of a rising potassium because that can put your patient in cardiac arrest risk. Sodium, normal 135 to 145. If it's too low, patient can develop seizures. If it's too high, dehydration and confusion. And when you're looking at sodium, if there is a sudden drop in sodium, think cerebral swelling. Okay. Hemoglobin, normal for men, 13 to 17, normal for women, 12 to 16. If it's dropping, that's letting you know bleeding. Creatinine, normal 0.6 to 1.3 milliliters per deciliter. If it's rising, that's letting you know kidney failure. And so you're gonna have to teach your patient to avoid nephrotoxic drugs like contrast dyes or your NSAIDs. Lactate level, normal 0.5 to 2. If it's trending upward, that's letting you know sepsis or tissue hypoxia. White blood cell count, normal, 4,000 to 11,000. If it's rising and your patient has a fever, you're thinking infection and you're thinking sepsis risk. Let's see. If your white blood cell count is dropping, think immunocompromised or neutropenic precautions. Let's move on to a case study. You have four clients. Which cue and trend matter most? Number one, you have a COPD patient with an SpO2 of 90% on 2 liters of oxygen, respiratory rate 28. Second patient, DVT patient, now reporting new shortness of breath. Number three, post-op patient with a heart rate of 128, blood pressure 98/58, which was 122/78 about an hour ago. And fourth patient, pancreatitis patient with severe pain, 9 out of 10, but vital signs were stable. So let's break it down. Number one, COPD. 90% may be acceptable baseline, but respiratory rate of 28, it's distress. That's high risk, but in this case, not the highest. Number two, DVT plus new shortness of breath. This is classic for a pulmonary embolism. This is your priority out of these four patients. This is the person that you'll see first. Number three, post-op patient with a falling blood pressure and a rising heart rate. You're thinking shock, so this will be the second person that you will see. And number four, pain, 9 out of 10. It's important, but you got to save a person's life first. So this actually, pain would be the last priority. So let's do a mini challenge. Which of OQs matter most? You have a potassium of 5.8. You have a blood pressure of 92/58, but it was 128/80. You have an SpO2 of 91% on room air, and you have new confusion in a 72-year-old with a UTI. So what do you think? So actually, there's a tie in this mini challenge. Answers B and D. So B, the big issue is the falling blood pressure. That'll tell you shock, and that'll kill a person fast. All right. And then D, you have this new confusion that could be sepsis or hypoxia, which is very high priority. A is dangerous, but it's a slower danger. And then C is mild hypoxia, and it's correctable. So to wrap it up, you know, hopefully now the signs of earlier deterioration of your patient. That skill will separate safe nurses from unsafe nurses. And so remember, trends beat a single number, new symptoms beat chronic ones, confusion is never normal, low blood pressure plus a high heart rate, that's shock, and rapid breathing is the first sign that something is right. And so that's it. Download, the full clinical judgment and prioritization workbook on NurseEdScholar.com for practice cases and rationales. Don't forget to like this video, subscribe, and hit that notification bell so you don't miss lesson 4, delegation and scope. You are becoming the type of nurse every patient deserves. And I'm proud of you. And thank you for watching Nurse Ed Scholar.